For years, we've been taught standard of care. When I was the chief medical officer, all I talked about all day was, did they meet standard of care? But we never talked about, did they do best care? Did they deliver the best care they could? It was always, what's the bare minimum required? Which is wrong, but that's the way we were taught, right? So whenever you do something, it's always, do we meet the standard of care? If your standard of care is here, then one day, if you're off your game, you're going to fall below very quickly. But if your standard is here, saying I'm going to deliver the best care, if you're off your game one day, it's going to drop a little bit. You still got a little buffer. So I think even the new residents coming out now, when you start talking to them, man, they got some legal verbiage I never had. Like they're right on it. I mean, they're like, oh, this is standard of care. I'm like, damn, where'd you hear all that? So they're already in that mode of doing the minimum they can, right? They want to do 40 hours a week, maybe 36, but not 41, right? It's the same thing. They want to do the bare minimum to skate by. And I think that's where the problem is. Our mindset is recalibrated to say, 98% is okay. Doing standard of care is okay. It's not okay. On a bad day, you're going to fall. So really, standard of care in my mind is just following dummy protocols. Anybody can follow protocols. Anybody can deliver standard of care. My nurses can deliver standard of care. What you and I should be focused on is delivering the best care. When I say best care, what I'm looking at is looking at the zebras, looking at the atypicals, looking at the unusuals, right? Your patient with PE, unusual presentation of PE, passes out and you don't know why. Or this mono guy, it's not your simple mono. The guy keeps coming back over and over again. There's a problem, guys. He's 17 years old. He doesn't ever see a doctor. He saw 6, 7 doctors in 10 days. Do you not think that's a problem? Right? Those are the zebras. Those are the ones that we should be focused on and not the standard of care. We should leave the standard of care protocols to the nurses and others to follow so that we can focus our time, the 5% that we're going to miss. So really, what's the next best thing next to best care? Doing the right thing, right? I mean, if you really think about it, and I'm convinced in the industry we are in today, the only group that actually could deliver the right care is you guys. You know why? Because you guys are the referee, are the quarterback, are the coach, the navigator, whatever you want to call yourself. You are the centerpiece of this patient's encounters. This patient goes to 6 different specialists. All of them do 6 different medications. An average rheumatologist spends 5 minutes with the patient every year and dispenses over an average prescription, a rheumatologist prescribes per year is $6,200 per year average prescription cost, and spends 5 minutes with the patient once a year. That's insane. There's no way a specialist, a cardiologist, every 6 months can review your chart in 5 minutes. He doesn't even know what other people are giving the patient. He just says, are you still on ditch? Oh, good. Are you still on this? Oh, good. Are you still on correct? Oh, perfect. Well, we're done. No chest pain. That's it, right? Have you taken your parents to the cardiologist? Okay? So that's all they do. And I don't blame them. They're laser focused in that area. I get it. I totally get it. But you guys actually have the entire patient at your disposal. You should have all the history. You should have all the things coming into your office, so you can then manage the patient as a whole entity and the drug interactions, right? I mean, I've had patients on like 10 different medications, and you look at it and say, oh my gosh, why? And then you can start plucking some of these away. And I'm not saying we have time, but really the only person that can take time is internal medicine family doc, and truly family docs. And I'm convinced, I've done so many things in different arenas, I'm convinced today the only place to deliver the right care, not the standard care, not the best care, but the right care is with you guys. All right, thank you very much.